Doctors, therapist of Reddit, do you have any "no, that's not normal" stories? If so, what abnormal habit oddity did the patient have thinking it was normal? Story 1. Not a doctor, but I had an experience like this with someone I slept with. We had just finished and were cuddling when he remarked that he was happy he felt like he was in his body. I looked at him funny and asked him what he meant, and he said, "You know that funny feeling you get after sex where you feel like you're not in your body? You're like looking at yourself from the opposite side of the room? Well, right now I don't feel like that, I feel happy instead." I tried my best to not look horrified and I asked him if it was always like that for him. He explained to me that it only started happening after something awful happened to him 2 years ago. I had to do my best to gently explain that no, I do not get that funny feeling and most people don't. I also had to explain, to the best of non-professional capacity, what disassociation was. Story 2. Guy in his 20s came in complaining of belly button problem. I examined him, he had an irritated scab inside the belly button caused by aggressive lint picking. But dude was sweaty and had a slight tremor. Looked like crap. When I asked how he was feeling overall, he said, "Oh, okay, I guess. Just a little tired, drank a little more this week than usual. Probably overdid it." I had to pry for details, and turns out he drank a gallon of gin over the last 3 days and stopped drinking alcohol when he started vomiting large amounts of blood and pooping a mixture of bright red blood and dark sticky stuff, melina, digested blood. He was totally unaware of the fact that he was going through alcohol withdrawal, sweating, shaking, because he hadn't stopped drinking long enough in recent memory to experience symptoms. I sent him straight to the emergency room, where they found a tear in his esophagus that required immediate intervention, and he was admitted for inpatient alcohol detox. I read his hospital note, he still insisted that the ED doc examine his belly button. Story 3. Woman came to the hospital because she was feeling tired and casually mentioned her persistent vaginal bleeding she'd been dealing with for 2 months. She said it wasn't ever a large amount, so she didn't think twice about it. Labs were done and her hemoglobin was 3.9. For context, that's low. Like, you should be dying low. But she looked perfectly fine. Story 4. 50-ish-year-old man who came in for chronic issue follow-up, he brought his wife with him this time around. At the end of the visit, she says, "Hey, tell the doc about that thing you can do." He turns to me proudly and tells me that he can whistle from his penis. If he really pushed, he could blow gas from it. His wife insisted it wasn't normal, but he was certain most guys could. Turns out, he had a connection between his bowel and his bladder. Mom brings her kid in because the babysitter was concerned about these spells the child would have. Apparently, the child would have episodes where he would just blankly stare at them and not acknowledge whatever it is they were telling him, or whatever he was doing. The parents just thought he was being an asshole and not listening to them, or being absent-minded. Kid turned out to be having absence seizures. A younger gal who had come in for generalized abdominal pain that she experienced on and off for years, but just always wrote off to either menstrual cramps or bad food or life. We had asked her if her bowel movements were regular, and she said yes. At some point, someone was sharp enough to ask her how often she had bowel movements, to which she said, about once every 2 to 3 weeks. She had been suffering from pretty severe constipation, but just thought it was normal to have BMs once to twice a month. I'm sure I have more, but I think I wrote enough for now. Story 5. I was the patient, but when I went in for a routine physical, the doctor poked my extended belly and asked how long it had been like that. I laughed and said, "What? My beer belly? Oh, since I was 21 probably." Turned out that, no, that beer belly was a cyst that had grown really large, and that was why my friends kept saying I looked pregnant. I thought I just had really shitty friends. Had to have emergency surgery, and for a week or so they did not know if it was a cyst or ovarian cancer. It was a pretty big scare. Story 6. I was the patient. I had no idea that it wasn't normal to uncontrollably sob for 2 weeks out of every month, have breasts so sore I couldn't go downstairs, jiggle, and then have it all stop the day you start your period. It took me getting a female roommate at 30 for me to realize that wasn't typical. I asked my OBGYN after charting my symptoms for 6 months. PMDD, a depressive disorder that is tied to your menstruation. A change in birth control pills fixed it right up. He also looked at me like I was crazy for thinking that was normal for 16 years. I asked my mom after my diagnosis, "Oh yeah. Remember in high school? Your friends would come over and ask if you were crazy that day or not." "No, Mom. They didn't ask me that. Thanks for letting me know." Story 7. I feel like my story belongs here even though I'm the patient, since the exact scenario happened to me. A few years back my mental health totally took a skydive. As a result I dropped out of school and had to start a recovery program. The first thing I had to do was talk to a psychologist. During these conversations with the psychologist, she'd focus on different parts of my life. So one day she'd ask about relationships and the next, childhood memories and so on. After a few conversations she focused on my social life. I then told her that it's pretty much non-existent, and it always has been. She then stated that I must have suffered from loneliness a lot then. I just told her that I've never actually felt lonely at any point in my life. After all, it's pretty hard to feel lonely with the two voices in your head always keeping conversation. But surely she knew that, right? Well, as it turns out, no. Apparently everybody else only have their own voice in their head. My entire life has been a lie. Turns out I'm schizophrenic. Who TF knew I? Story 8. This was a time I was told something I did wasn't normal. I was in physical therapy recovering from a back surgery. My in-home physical therapist was having me do stretches and asked me to extend my leg as far as possible and straighten my knee. So I do this and my knee inverts, which to me was totally normal, but my PT was very surprised. She explained that was very abnormal and she had not seen hyperflexible knees like mine before. So now I know my wonky bird knees are not normal. Story 9. Obligatory, I'm the patient. I thought for years that I was just continually getting more and more out of shape. Despite my best efforts, nothing helped. I would just hit this wall and couldn't keep going. Eventually I couldn't walk from my driveway to my house without needing a break to breathe. Turns out shortness of breath isn't just something to wave away, it's also something I wish doctors had taken seriously. In the span of 2 weeks, I went from seeing a local clinic PA to being admitted to the ICU. My doctor told my husband he had no idea how I was still alive, nevertheless functioning. Story 10. Was on urology rotation in medical school when a 20-something-year-old male presented with the complaint that one of his nuts was too small, and he wanted them to be equal because it was embarrassing. One testicle was normal, the too small one, while the other was the size of a grapefruit. Unfortunately, the cancer had metastasized. Not sure how he did long-term as I rotated off the service after he had surgery. Story 11. As a patient, I went in for a standard sleep study because I was always exhausted. Doctor asked me afterwards if I would consider signing a release for him to write a paper on me. Apparently I moved my legs over 9,000 in the course of the night. Apparently it was RLS, I wasn't realizing I had. My wife never even told me I did it and I had no idea. She casually agreed after I told her what the doc said. I barely met the REQs for moderate sleep apnea, where they will RX a machine. God, I love that thing. I sleep so much better with it. Wifey on the other hand, uses hers and sleeps with her mouth open. So annoying to listen to the air hiss out all night. Story 12. I had a root canal needed in a molar. I went in so he could prep it for the next step, but 2 hours in and he had to call it for the day. So by the 4th 2-hour visit, when it was finally done, I was sick of seeing my dentist. Almost a year later I'm back at the dentist, and he turns to his assistant and says, "This is the one with that root canal." I'm a legend, apparently. Story 13. Not a doctor, but when I was maybe 14 or 13 I remember describing to my primary how during my periods I would pass out from the pain, couldn't move or I would get sick, and told her a story about how I went on a trip to Italy and sometime in the middle of the flight became wildly sick to the point of terrifying the poor flight attendants. I'm so sorry flight attendants, by filling 4 puke bags, crawling to the back of the plane clutching my stomach, finding the doors locked attempting to use the first-class bathrooms so I could finish being sick. When denied entry just lay down in the aisle waiting for sweet sweet death to take me, it did not. Death has terrible customer service, and then passed out when we exited the plane. But periods are supposed to be painful, right? The doctor was like, "Honey, you're supposed to experience some discomfort, not be incapacitated." Anyway, she put me on birth control and I've never been happier. Story 14. 95-year-old veteran 5 years in remission from kidney cancer. Came in with 72-years-old wife for routine follow-up. She wants to know if it's safe to have sex every day, because she is worried about his health. Yup. 95 years old, fucks every day. No Viagra. We just said, congratulations. Yes, sex every day is very good for your reproductive tract, penis or vagina. It keeps blood flow going and helps you maintain function of your bits for as long as possible. Use it or lose it, essentially. And it doesn't have to be with someone else either. Story 15. I was the patient. When I was growing up, I had constant stomach aches. Every time I ate, I'd get sick. I went to the doctor multiple times for it, but they could never figure out what was wrong. Eventually, I started to think that everyone lives with pain like that, and I was just being a wimp and couldn't deal with it. I barely ate, such that I was super underweight. I was miserable all the time. I was constantly stressed and depressed because of this problem. Fast forward to grad school. My first year is in China. I'm there for a few months and then, over time, my symptoms disappear. I don't have stomach aches anymore. I gain about 40 pounds seemingly overnight. Now I'm at a healthy, doctor-approved weight. My depressive symptoms disappear almost entirely. But how could that happen? What could have caused such a change? Turns out, I'm lactose intolerant. I grew up in the Midwest where pretty much everything has dairy in it, and I'd been eating it constantly for so long, it took months for my system to reset. Being in China where dairy isn't such a staple made all the difference. I felt like such an idiot when I realized that was what was making me ill. On the plus side, I feel better, look better, and am a much happier person now. Story 16. When I finally got on medication for my anxiety, I found out getting irrationally angry and frustrated almost to the point of crying and screaming at people for touching things certain ways, putting the dishes away wrong, chewing, moving my stuff a few inches, or talking to me when I didn't feel like talking was, in fact, not normal. Thank God for Prozac.